Hello, my name is Frank Brown and I'm a mental health professional for the last almost 28 years. And I want to share with you some thoughts regarding the proposals of our expert review group recommendations to change the Irish Mental Health Act 2001 so as to make sure it complies with human rights legislation, but particularly the incapacity legislation that is about to be implemented. However, my major concern, and I know this is shared with many of my mental health social work colleagues who work with involuntary patients, who work in the forensic mental health services, and I know our psychiatrists feel strongly too, that there's absolutely no need to change the criteria for involuntary admission. The reason particularly is in relation to health ground. There is no need to change the definition of a mental disorder, especially in relation to that health ground. The fact that most, if not all, applications will be made by a HSE authorised officer, an applicant who's looking for the least restrictive alternative. The proposal is to use the wording imminent threat to the health of the person rather than a serious deterioration. Clearly, people with psychotic illnesses, schizophrenia, schizoaffective illness, when they stop taking treatment or when they relapse, it's a gradual process. Yes, people can become very unwell quickly. But if one has to wait for that imminent threat to health of the person, you're calling, you're visiting, and perhaps they're becoming a little bit unwell. You're not there at night time when they're shouting or maybe knocking on neighbours' doors. You're not there when they're not paying bills or they're paranoid about all sorts of mail they get or the television. So you're often waiting until they're very, very unwell. But what's really concerning is that when they're admitted to hospital, and as soon as their health is not as imminent, as there's no imminent threat to their health, the psychiatrist has to remove them from that involuntary detention order. What that can mean is they may decide, look, I'm going home and I'm not going to have anything to do with you. That may be fine and dandy if they remain well. But if there's someone who's been mentally unwell for a long time with several admissions, what's going to happen is that whole process of involuntary admission happens again. Families and neighbours ringing up really concerned about the behaviour of their loved one. Professionals calling out, AO applicant, whoever, GP, calling 2, 3, 4 times to try to catch the person in. Then the assisted admissions, a team of nurses who called to try to take the person to hospital, the Gardaí. The traumatic process all begins again because our expert review group have opted for imminent threat to the health of the person rather what is already in place, serious deterioration. The risk to self and others, they've suggested that it needs to be now it is imminently necessary for the protection of the life of the person, as opposed to what it was, which is there's a serious likelihood of the person causing immediate and serious harm to himself or others. There's no need for this change, and the consequences will not be what was hoped for, and potentially putting that patient at risk, premature discharge, late treatment and admission, and the longer one is left untreated, the worse it is for the person in question, their mental health, but also all those relationships.